Tissue embedding, blocking, or casting. Tissue embedding involves surrounding a processed tissue with a much stronger media that will give it support during microtomy. In other words, in the whole process, the tissue is surrounded with a molten medium with help of a tissue mold. Subsequently, this medium is solidified to make a tissue block for cutting thin sections of tissue. Therefore, the major aim of tissue embedding is formation of a tissue block. There are different agents or media that are used in tissue embedding. For example, paraffin wax, carbon wax, plastic or resin, agar-gel, gelatin, and celluloid. However, the commonly used embedding medium is paraffin wax. Generally, tissue embedding involves the following steps. Number one, we are going to pick up our sample from tissue cassette compartment. Place on your warm surface. Okay. Then we open. So you look at the size of the sample. So the size of the sample will tell the size of the mold to be used. Because we have different sizes of molds. You have a small one, followed by this, then followed by this one. Okay? So you look at the size of the tissue, then you compare which size of the mold I should use. Why? If you get this tissue and put in this mold, what will happen? It will protrude on the side, okay? Literally, you're going to fold this tissue. Even orientation will not take place as required, okay? The same, it doesn't make sense having a small piece of tissue, then you use a bigger mold. That is the wastage. We may be having bigger tissues that will require this mold. What would be the appropriate mold basing on the size of this tissue? The middle one, not this one. Why? Why don't we use this one and we're using this? This one is large. Okay, we're going to try. Okay, we're going to supply the mold with paraffin wax. So carry our tissue into the mold. Transfer onto the cold plate and orient, put it properly in the mold. We taper to ensure that the tissue is on the surface of the mold. We use the tissue cassette base and place on top. The tissue cassette base has the patient's identification. We raise. So from the small cold plate, we don't put on the warm surface. What will happen? It will melt, okay, because this is a warm surface. So you raise and completely fill with paraffin wax. Then you transfer to the large cold plate for complete solidification. So here there is a rapid solidification. When you look at the temperatures, it is -4. So in most cases, it is between -5 to -15. Those temperatures will give us rapid solidification of the wax. However, the timing between the small cold plate and raising to completely fill the mold should be very short. Okay? Because if you delay and this one solidifies, then you add on paraffin wax, it also solidifies. What is going to happen? You are going to form two layers, like in blood. Is it blood agar? Double layered. Okay. So the more you delay, first wax that was put in the mold will solidify. So the time should be literally very short, so that we form a uniform tissue block. Otherwise, if you form two layers, it is bound to cracking during microtomy. And that means you'll have to come back and re-embed the tissue. And just imagine it happens to 100 samples. You have to come back and re-embed. One, there is delay, patients getting the result. After we separate. Okay, so this is what we embedded. When you separate, you're forming a tissue block. So it is this tissue block, literally this is the representative of the whole specimen. For example, if it is the whole breast, the whole breast is not here, but we sampled different parts of the breast. Okay, so this is true of the patient now. This that we put on a microtome to form or to cut tissue sections that we finally put on the slide, stain, examine, and give diagnosis. So this tissue block, we can keep it for very long period of time at room temperature. Even when there are any other tests that can be done, we don't need again the other sample, because literally they are stored for some time, then discarded. So you're not going to look for where they discarded these samples. Just get patient, this number, we retrieve, again, cut, okay? Stain, give the result, depending on the test you want to carry out. So it is your storage that will disappoint you, because if they are not properly stored, they are usually eaten by rats. You find the rat has eaten half of it. So where it ate is where the disease is. Just imagine. That's a gone case.